Hello, everyone, and good morning. We are so pleased to welcome you to the information session for the inaugural Community Impact Research Grants in Cancer Health Equity Request for Proposals. This RFP is sponsored by the Stanford Cancer Institute in collaboration with the Center for Population Health Sciences here at Stanford. It is made possible through generous funding from the SCI. SCI and PHS have a shared interest in reducing disparities in health outcomes through community-driven research. Today, I just wanted to go over our brief agenda. We will have some introductions, then provide an overview of the RFP. We'll talk about requirements and eligibility, as well as funding and the application timeline. We will also share information about PHS and the resources that it may have that will be useful to you in this particular RFP. We'll then open the door for Q&A. Before we begin, a bit of housekeeping. We use the chat function to record questions as they come up. Please do use the chat function to enter your questions. We will leave time at the end of the session to answer your questions. My name is Elise Adams, and I am the Stanford Medicine Innovation Professor, as well as the Associate Director for Community Outreach and Engagement at SCI. I will now introduce my colleagues. Starting with Melissa Bondi.
Hi, good morning, everybody, and thank you so much for being here today. I'm Melissa Bondi, and I am the chair of the Department of Epidemiology and Population Health, and I'm also the Associate Director for just brought everybody together. I'm also the Associate Director for Population Sciences at the Stanford Cancer Institute and the co-director with David Rakoff for the Center for Population Health Sciences. And we're really happy that you're all here today and interested in this RFA that we're really excited about. And first time we're launching something like this. And I would like to pass this on to introduce the next person, who I think is Bella or Leslie, Bella.
So I'm Isabella Chu. I'm the Associate Director for the Data Core for the Stanford Center for Population Health Sciences, and I'll just be sort of sharing about our data sets that you can use for all kinds of population health research and the systems that we have for you to work on those data. I'm very excited to see this program initiated.
And I'm Eileen Burnaby, the Operations Manager for the Center for Population Health Sciences. And I'm very pleased to be here with all of you. I help administer the RFP as we launch it today. I'm really happy to see all of you attend, and we are very interested and excited about this program. And now we have Leslie.
Good morning, everyone. I'm Leslie Sept. I'm the Executive Director for the Center for Population Health Sciences. And as we move forward, one of the things I want to say is if you don't happen to have cancer expertise or climate change expertise, we are happy to help make those connections and encourage you to reach out, because that is what we are here for. We're very fortunate to have our partners here today from the San Joaquin Valley Public Health Consortium. They were actually the very first group that we thought of when we knew this was going to have an equity focus. They'll tell you more about what they're doing, but it's a theme that really runs through everything that they do. So today we have Alyssa Kent, who's the director of the consortium, is with us. And I don't know how she does it, but there's 11 consortium members, and somehow she manages to bring them all together to get important work done. And I can't tell you how difficult that job is. And then Eric Serdenko is also here today, and he has two hats. He is the health officer for Mariposa County, and he is also the co-chair of the consortium. So I will let him take it from there to tell you a little bit about the consortium and also their interests related to climate change and cancer inequalities.
All right, well, thank you, Leslie. And Alyssa can fill in any of the blanks that I miss out on, because again, she is the best at cat herding the 11 counties that are participating members of the San Joaquin Valley Public Health Consortium. And so we do, it is the membership of the San Joaquin Valley Public Health Consortium is the 11 local health jurisdictions within the San Joaquin Valley minus Kern County. And we have transitioned over the last decade from basically being an information sharing body to being active in shaping what we understand are the health impacts of our residents and looking at mitigations for that. And specifically within this opportunity, if I understand it correctly, and I'm again, this is where Leslie, you can correct me, but we are concerned about the impact of climate change in the San Joaquin Valley. And as most of you may know, is that some of the most impacted counties due to poor air quality live within the San Joaquin Valley and within the Central Valley. And so air quality, just before climate change, going back to the 70s, even earlier, air quality has been an issue here. But as we see climate change, as we see drier fuels, as we see hotter, longer summers, as we see fire conditions worsening, we also see the opportunity for wildfires to have a greater impact on our population in addition to the day-to-day air pollution that exists, because we are decreasing particulate matter. We are decreasing non-point sources of pollution from things like diesel trucks that drive up and down 99 and I-5. But one place we have seen an increase in is in the production of particulate matter and other known carcinogens associated with wildland fire, whether they're polycyclic aromatic hydrocarbons or volatile organic compounds. And those are getting dispersed into the air and then have the potential to impact our most at-risk populations, people who can't shelter in place. So people like agricultural workers who are out in the fields, who are exposed to these. And really where we're lacking right now is any longitudinal studies. We have some point in time studies, we have case reports, but there hasn't been that look at the population as a whole and the look at what are the changes in exposure and the changes in outcomes from that exposure from the increased fire impacts we're seeing, whether it's, right now I'm at home because we stopped here to use Wi-Fi because I was out with the California Office of Emergency Services looking at the footprint from the Oak Fire. And many of you may have missed that, but a 20,000 acre fire went through Mariposa County back in July, and we're just starting to think about the longitudinal health impacts of that. But I think what we want to do is use these fires as opportunities to look at impacts on health, whether it's episodic like Oak fires or more longitudinal as we look at impacts across a larger geographic area. And I think I captured most of the areas that I was thinking about. So Leslie, I hope I did that, capture your ideas as well.
You did a fantastic job. Thank you.
And looking in the chat box, how long do you mean by longitudinal? Really long. No, I shouldn't say that. That's so from, you think about in terms of cancer registries, right? You're thinking about years to decades. And I think that's really, if I were to be thinking in that term, in terms of a cancer registry, that's the sort of longitudinal stuff I'm looking for is really how do we, and not just, in the grand public health scheming is like, how can we get more data? I actually think this is a statewide question as well. It's not just the San Joaquin Valley, it's not just the adjacent foothills, it's wherever there are impacts from wildland fire smoke and recognizing those impacts occur over time. And I will say when I got interested in wildland fire smoke, it was like the basic literature was, hey, it's episodic, you'll be exposed to it for 1 to 2 days to maybe a week at most. And then if you go to the beach and face into the Pacific Ocean and get good air for a couple of weeks, you'll be back to normal. I don't know if that was ever true, but you're not seeing that relief now. You're seeing ongoing impacts from continual wildfires. And even where a fire in Northern California, the McKinney fire, or a fire in Nevada County can impact counties that are hundreds, if not thousands of miles away. All right. And then a next question from Eladia Tafoya, is this applicable to the Bay Area NorCal residents as well, or only applicable to San Joaquin Valley? I'm going to defer to Leslie or somebody else on that one.
So it depends. We have two different tracks. So the first track is really meant to be responsive to what our partner is interested in. You know, but there's also a second track, which is a little bit broader. So you could, but it also, you know, it sounds like even for the first track that Eric could have an interest in that. You know?
Yeah, I mean, if it was up to me as the San Joaquin Valley Public Health Consortium, clearly I would want a focus on the San Joaquin Valley, but I think recognizing that smoke doesn't recognize jurisdictional boundaries, looking more broadly if resources allow for that is you know, because like as a county in Mariposa County, I'm just looking at my population, but I think it is critical to look at adjacent jurisdictions as well, and then spread it out from there as long as resources allow. So, you know, tangential to this conversation, I'm already talking with the California Department of Public Health and the Centers for Disease Control and Prevention about just looking at the oak fire, and they have those same interests. And so I think as academia, how can we build that partnership between academia and public health practitioners? But again, that's sort of tangential, and Leslie knows I goes down rabbit holes, so I will not do that today.
That's a great tangent, though. You know, before we're going to, Alyssa, we never got a chance to let you introduce yourself.
She was supposed to save me if I missed anything, so she can hop in and introduce herself.
No, I think you did great. So I'll introduce myself. My name is Alyssa Kennett. I'm the director for the San Joaquin Valley Public Health Consortium, and Leslie has just been so patient with our many questions and has really pursued opportunities to partner with us, and so we appreciate it, and we're excited to see what the outcome of this RFP could be.
Thanks so much, Alyssa, and thanks everyone for your introductions. Please do keep the questions coming in the chat. We promise we will get to your questions at the end, and we'll leave plenty of time to do that. So again, I just want to provide a brief overview of the RFA. The call for proposals has two distinct opportunities, as Leslie mentioned. The first is the Grand Challenge. This does focus on the San Joaquin Valley and would provide up to $100,000 for a research project directed at their interests that would be good for 2 years. The second challenge is, or track, I should say, is a Cancer Health Equity Seed Grants. That is a broader opportunity for pilot projects for up to $40,000 for up to 1 year. And now I'm going to talk a little bit about each of those tracks or opportunities. The first, the Grand Challenge, as you just heard, San Joaquin is a vibrant and diverse community. It is also a critical agricultural producer to the nation. As you just heard from our colleagues at the San Joaquin Public Health Consortium, it is concerned about climate change and poor air quality in these communities. They are particularly interested in population-based longitudinal studies of the impact of these factors on health equity. For example, they're interested in knowing how wildfires and the resulting air quality affect cancer prevention and control, particularly among frontline workers and vulnerable populations within the communities. And also they're interested in what strategies might be used to reduce these risks and improve equity. I should note that this is not purely descriptive research, but really seeks to understand and address the needs of the communities. Proposals that are responsive may take many forms. They may be analytic projects, they may be more conceptual, but we really hope that there will be community engagement. In particular, while they're not required to be community-based participatory research projects, awardees will be expected to present their results to the consortium upon completion of the project, and preferably before that in terms of getting guidance about the research and how it's going. We are able to connect potential applicants to cancer and climate change experts if you don't have expertise in this area, in particular on your team. And we highly, highly encourage using one of Stanford's great assets, which is our transdisciplinary campus, to address and collaborate to address these needs. And please do contact Leslie and others if you have questions about this, and her information is in the RFP. Please note that only one Grand Challenge grant will be funded this year, but we truly hope that people will think out of the box and be collaborative in their approaches. The second opportunity is our Cancer Health Equity Seed Grant Program. The seed grants see proposals focused on understanding and reducing cancer disparities among underserved populations in California. These are not limited to a specific topic, cancer type, or study design, or even necessarily a particular county or region of Northern California. We are particularly interested in the 10 counties within the Stanford Cancer Institute catchment area, which again are listed directly in the RFP. Preference will be given to proposals that focus on counties served by our catchment area, and in particular the following priority areas: understanding and addressing structural and institutional factors that drive cancer disparities in persistent poverty areas, promoting cancer equity in the San Joaquin Valley region, and leveraging real-world data to reduce cancer disparities in California. You don't have to do all of those things, but we're hoping that you'll focus on at least one of those areas in your responses to this particular seed grant opportunity. We're particularly interested in structural and institutional factors. We want to talk a little bit about what we mean by that. By those factors, we include, but not limited to, residential segregation, institutional and systemic racism, and interrelated factors inherent in the economy, such as employment, income, and educational opportunities. To promote cancer health equity in the Stanford catchment area, as well as the San Joaquin Valley region in particular, we're seeking projects that, as they scale, are likely to yield actionable research that can be utilized by key stakeholders to promote cancer health equity in the San Joaquin Valley region, as well as in the catchment area. In particular, San Joaquin Valley is the focus of track 1. However, proposals are not required to focus on the San Joaquin Valley only for track 2. However, we're hoping these findings will be applicable to the region. We hope that people will leverage real-world data to reduce cancer disparities in California. We're particularly interested in innovation here and harnessing the real-world data capacity to really help us understand and address these disparities. For example, applicants could propose a blueprint for co-creating data systems and data ecosystems that will be of use to our catchment area counties, and in particular, build capacity within those communities to address these issues going forward using science. We're also hoping these strategies will produce some sustainable changes within our counties to improve health equity. We're particularly interested in projects that can also be used as a use case and then potentially brought up to scale and exported to other parts of the region in terms of addressing some of these needs. As you just heard, wildfires, for example, don't care what your zip code is. And in that sense, it's very important for us that the projects that we're producing have import not only for specifically the San Joaquin Valley region, for example, but the potential to help other counties within our catchment area as well. So I think the next slide should provide our evaluative criteria. They're very similar across the two, but there are some subtle differences, but I'll go over briefly what some of the evaluative criteria are now. In terms of impact, as a project evolves, we hope into a larger full-scale project, that it will produce knowledge that will inform cancer-related policy, practice, and/or paradigms. So even if you're doing a seed grant program that won't necessarily have that large impact right away, we hope that you're thinking big in terms of how it can help you get on a pathway to bigger impact. Similarly, we want a health equity focus. We want to know if the project has the potential to generate knowledge that can contribute to the promotion of cancer health equity. We're also very interested, as I mentioned, in community engagement, that we were interested in projects that propose to have key stakeholders who can be identified and then engaged in the research. And we're happy to facilitate bidirectional partnerships throughout the projects with the key stakeholders. We're also wondering whether or not the project will, in terms of the goals and objectives, be met in terms of utilizing the proposed study designs and methods. In other words, will the study designs proposed address the needs of interest? Further, we'll be interested in whether or not the budget and scope are appropriate and whether the timeline seems reasonable for the project proposed. We're also interested in whether or not the project might facilitate, again, collaborative work, preferably across disciplines and also across stages of career development for the scientists. Lastly, we're interested in the potential for, again, the project to lead to longer term projects that might include some more comprehensive and collaborative project scope. And then finally, under the grand challenge, we'll also be looking at how well the proposed project in particular meets the needs of the community partners and their interests with respect to cancer health equity. So now I will be handing this off to, sorry, I think we addressed that too. Sorry, I'm talking really fast to the slide holder. For slide 7, we'll also be now talking about requirements and eligibility and funding application timeline with Leslie.
Hi. So both tracks are really open to all faculty and early career scholars. We wanted to be inclusive and welcome everybody. But we are asking that a Stanford faculty member is listed as the PI. So if you're a clinical educator, for example, we welcome a proposal from you, but would just ask that you would have a Stanford faculty member who's listed as the PI. And again, we're also encouraging early career scholars to apply, and they can be listed as a co-PI. But again, they would just need a Stanford faculty member as the PI on the proposal. So the proposals are due October 14th. So you have some time to get this done. And the award notifications will actually go out December 9th. And then the award start date will be March 1st. And we are encouraging applicants to apply for less than the maximum. It increases your likelihood of being funded. And I think it also gives us a chance, to provide more awards. And so for the first track, the grand challenge is a 2-year award period, and it's up to $100,000. And then with the second track, which is a C grants, that is a 1-year award and up to $40,000.
So in order to use the real world data, I'm going to talk a little bit about data resources that the Stanford Center for Population Health Sciences already has available. And the way we think about what makes a high value data set is it large? Is it representative of the population from which it was derived? Is it longitudinal? Can you follow people over time? And is it linkable? Can you tie the data to other data sets, for example, granular geography and particulate matter data, or even be able to link by individual? Next, please. And so in order to use these really large data sets, which often have over 100 million people, we bundle that with the computational environment that's secure and powerful and flexible, and support in better understanding the data and managing the security of the data. So you don't have to worry about, do I need to buy a server? All of that is bundled with the data that PHS provides. Next slide, please. So then these are some of the data sets that we have. All of these are national data, but with good representation in California. So the first is the American Family Cohort. This is a outpatient EHR data set of about 7 million individuals. This is linkable by individual. We would do that linkage, obviously, but if you have an external data set, that could be linked by individual. Market scan is quite de-identified. The most granular geography is about at the county level, but this is over 100 million people. It's about 140 million people. And this is outpatient, this is claims data. And we also have lab data that we'll be getting this year. We have Medicare, 20% of patients enrolled in Medicare nationally. We have 2006 through 2018, and we're getting 19 and 20 now. So by the time this grant starts, we'll have 2006 through 2020, or through 2020, and you'll be able to follow patients longitudinally. Similarly, we have Medicaid, 100% of records. for 2011 through 2019. And importantly, both of these data sets have very granular geography down to 9-digit zip. And then we are willing to, so we do not currently host SEER, Medicare, Medicaid linked data, but we're very happy to help you get that. If you're going to use that kind of data, as well as the Medicare and Medicaid data, please allow up to 90 days to complete your application. There is a process. We have a 100% success rate, but it does take time to apply for and be approved to use those data and to get those linkages done. And finally, a very exciting new data set. This is called the Harvard Hyperlocal Air Quality Data. It's in 50 square meter, partitions. I think they're called rasters. I'm somewhat new to environmental data. And this is, again, a national data set with the components of air pollution at very, very granular levels. So you can easily imagine, if a particular field had an exposure, you would be able to see that in this data set. So these are some of the data sets we have. If you have other data that you're interested in, you think is essential for this kind of research, please do talk to us.
Great, thank you so much, Leslie and Bella. Now it is time for our Q&A session. Some of you have already posed questions in the chat. Thank you so much. If you're having trouble with that, please feel free to raise your hand as well. So first, I'm going to start with one of our first questions, which I believe had to do with longitudinality. And so we'll have a round robin here if there are others who have questions about this. But that first question is, what do we mean by longitudinal? So I just want to follow up on that. And I would say that what we mean by longitudinal is that we're going for projects that go beyond just describing the situation as it currently is. And we're particularly interested in projects that attempt to evaluate sort of the temporality between specific factors and the outcomes of interest. Because a lot of the outcomes that we're interested in are sort of, for example, might be health outcomes, they might be healthcare utilization. It's helpful to have those things over time for a couple of reasons. One is that there could be a disruption at a given point in time or a given year, which then could cause us to draw in sort of incorrect conclusions about the relationships that we see. The other is that the outcomes themselves may or may not lend themselves to shorter periods of time. For example, things like hospitalizations, they're always helpful if you have them over multiple years. Similarly, health services utilization, it helps to have it over a repeated measure. So that might be month to month, that may be quarter to quarter, that might be annually, but really it helps us assess that temporality between sort of factors that are of interest and the outcomes of interest. Certainly causal inference methods that allow you to get towards causal inference, even in the absence of, for example, a quasi-experimental design, are very much of interest. However, I just want to emphasize that we're really looking beyond descriptive data. And let me see if any of our colleagues have anything to add to that before we move to the next question.
I don't. I think you answered that question quite well, Elise.
Okay.
Looking for long-term, the longitudinal would be long, more on a long-term basis, to look at something over time.
Wonderful.
Mm-hmm.
Okay. So then it looks like the next question that I see is
there's the Wei-Ting Chen question about track 2.
Great. I think I might see, but thank you so much. So should prospective applicants prioritize the consortium members as key stakeholders, or can we leverage existing partnerships on the ground? We absolutely encourage you to leverage existing partnerships on the ground. The consortium will continue to be working with us very closely, so they will serve as reviewers. They will help be here in terms of providing guidance to applicants. So they will certainly be involved, but we absolutely encourage you to use your existing partnerships and hopefully grow and deepen those partnerships through this opportunity. So thank you so much for that great question, Wei-Ting. We have another question, which is, we could get more specific on track 2. Projects that use data sets and focus on the San Joaquin Valley be prioritized. At reducing melanoma disparity using community health workers, and we're not sure that quite fits, though it will be focused within this area. Absolutely, that could potentially fit, and I'd love to hear Melissa's thoughts on this. Again, for the seed grant programs, we're actually looking beyond the San Joaquin Valley into our larger catchment area, and we're very interested in strategies that have the potential to have portability across different communities. Certainly, melanoma disparities or certainly contribute to disparities in cancer and are of particular interest with many of our communities. And certainly the engagement of community health workers is absolutely fantastic. So I think that would certainly fit. And let me see if Melissa has any.
I totally agree with you that, you know, we have a large catchment area. The San Joaquin Valley is an area that our cancer center is interested in expanding into because of the cancer burden in that area, and also working with the partners who spoke today, and we're really interested in, especially because of the exposures that are there, the cancer burden in particular, but also continuing to work in areas that are already our catchment area. So melanoma is certainly a concern and a cancer that's of interest to our cancer center. So absolutely, that's important, but also working with community health workers is also something of interest. And we want to see the best proposals, and we want to see what people are going to bring to the table. And, you know, we've talked among ourselves that this is something that we haven't quite done before. And so we're really trying to get people to be as innovative as possible. And if we get multiple proposals that are really exciting, we're going to look for money to try to fund as many of these as we can.
Absolutely. Thank you so much, Melissa. I think the next question is where the recording will be posted, and so you can review it later. Absolutely, it will be posted on the webpage in the same place that we have the RFP. In addition, based on your questions and some other questions that have come in, we'll be developing a frequently asked questions document. So you can also refer to that, and that will also be available in the same place. Leslie or Eileen, did you have anything to add to that?
No, you
did it. You did
you did
handle
it
there.
beautifully. Yes.
Okay. Phew. Okay, thank you.
We'd like to have some discussion among the people on this on the webinar, on this call, and if people have questions, they want us to introduce them to others. We love being matchmakers for others to collaborate, so we're happy to do that. If anybody has obviously you're here because you have ideas, and we want to see great proposals, and so we want to encourage that. If you have questions along the way, we're here to answer them. And we're really happy to see those that are here. And if there's people that you know that are obviously aren't on this call today, they can contact us for more information as well.
Absolutely. And to your question, we will put in the chat a link to who you can contact about further questions after the webinar. So thank you for that reminder. Before we do that, we have a question from Andrea, and this might require some offline conversation for us to get a little bit more information. But the question is, can you rely on bidirectional partnerships to recruit participants? In particular, you're interested in increasing the independence for patients who are currently not able to fill out health questionnaires by themselves, and using technology to aid that. It sounds like a very interesting project. What I would say is this particular RFP is particularly focused on community needs and community priorities. So to the extent to which the community is interested in that type of technology or the work that you're doing, absolutely, that's fantastic. And we'd love to see it, particularly if it's focused on health equity. If not, there may be other sort of opportunities that would fit, but certainly if you contact us, and Eileen just put the email in the chat, we'd be happy to follow up with you with more specifics, because it sounds like we might need to know a little bit more information about your project in order to evaluate its appropriateness for this particular RFP. Thank you so much for your question. Interventions to reduce the impact of poor air quality in are there any interventions currently going on? So that's a great question. That might be more of a question for our San Joaquin Valley colleagues. I don't know if you actually know about existing interventions, or anyone else in the call actually might know or might be involved in concurrent interventions around air quality in the Central Valley.
I'll talk a little bit, and Melissa may have some more stuff, but yeah, I think one of the larger initiatives is a state level initiative from the Air Resources Board to reduce non-point source particulate matter. So you think about a diesel truck and a lot of movement up and down the I-5 and 99 corridors. That's been a big effort to reduce that. Other things that people have been looking at is reducing ag burning. So as much as we talk about wildland fire smoke, there's also a lot of ag burning that goes on right now. And so can we do things that will allow the land to be used in an agricultural setting without using fire? And then I'm trying to think about other point source reductions that I would probably have you reach out to the San Joaquin Valley Air Quality Management District. And we do have an active partnership with them. We met with them our last general meeting. And certainly they would have a host of interventions they're doing. And they're also looking at mitigation. And so looking at placement of what are called cleaner air centers so that you can get people out of the impacts of smoke. And then where a person actually absolutely has to work out in the hazardous environment, distribution of things like N95 respirators. So there are a number of interventions, both looking at prevention and mitigation. And the answer is no for Edward's last question.
Doesn't she have like such?
All right, was someone just trying to ask a question?
And that was the Cal OES 5 in the background here. I'm going to have to drop in a bit, but
Thank you so much.
Thank you for this effort.
We're really excited. You'll hear a lot more from us, Eric.
Yes.
All right, take care and have a great afternoon.
You
Thank
too.
you.
Thanks for being here with us.
Thanks for joining us, Eric.
So Wei Ting just put a really great question, a couple of really great questions in the chat. One of them about whether people can learn more about the program and policy priorities of the consortium. And so I don't know if Alyssa's still on and can answer that question, or maybe we can work behind the scenes to make that information available to the applicants.
Yeah, that's a great question.
I think Leslie, maybe you could talk to them and get back to, you will put it on the website.
Absolutely.
Right.
Wonderful. So I'm not getting any new questions. We'll wait a few more minutes for people. If they're thinking about asking a question, please don't be shy. One thing that I would say about this particular RFP is that we're serious when we say collaboration. We want to see people who haven't worked together before, who wanted to work together. We're really hoping that we can bring together diverse, dynamic teams of transdisciplinary, or that sort of reach across disciplines in order to address these particular questions. And so we want you to be creative. We want you to sort of reach out there and call somebody maybe you haven't called them yet, but wanted to work with. That's the kind of collaboration we're hoping to see. We're also looking for diversity and equity and inclusion in the research teams. The more, the better. So we'd love to hear about that aspect as well as you're developing proposals. And if you have questions for us about how we might be able to help you do that, please let us know. So through a direct contact for San Jose Consortium, San Joaquin Consortium for potential collaboration. I don't know that we have that set up. I think that PHS is going to provide that. You know, they are very busy public health officials. So I think what we'd like to do is provide a sort of concierge service to them, if you will. Leslie's laughing because she is the concierge in this case, but I think she'll be able to provide direct contact. Leslie, did you want to follow up?
Maybe people could talk to you, and then you can kind of help organize that, Leslie.
Exactly. We can definitely facilitate for sure.
Yeah. So Vijaytha, if you want to reach out, I think talk to Leslie first, and then, Leslie, you can kind of be the coordinator for that and facilitate it.
That sounds great.
Yeah. Any other questions?
Wonderful. Yeah, I'm not seeing any new questions.
No, I don't either. We don't want to take people's time up if they don't, if there aren't questions. So we're all available by email through the website that is, do you want to post that one? There it is, that last slide. And so we're, we are around, always answering emails, and also connecting with Leslie so we can keep things coordinated. And so the email is stanpop health@stanford.edu, and Leslie will be coordinating all of those requests and questions. And then the link to apply is right there on that link, seedfunding.stanford.edu. And remember, application deadline is hard and fast. We're giving you enough time to apply at 5 p.m. PDT, Friday, October 14th.
And there was one last question about a follow-up meeting. We don't plan to have another information session, but we will, of course, this recording will be available in a frequently asked questions document will be created. In addition, you have the direct contact to our group to be able to email us to ask any questions, and we're happy to meet with you and talk through questions, because it's challenging, right? Once you start to develop a research question, you don't know what you don't know. So once you start developing the proposal, we're happy to talk with you again. Great. Thanks.
Thanks much for your interest. And we look forward to seeing proposals.
Thanks, everyone.
Thank you, everyone.
Thanks.
Thank you.